So we're going to talk about health and climate. Of course, we're no stranger to the health threats that we've all seen, right? Pandemics, food systems, urban development, they all impact the way we're able to eat, get fed, and stay healthy. So I want to welcome to the stage Gayle Tzemach Lemmon. She's the Adjunct Senior Fellow for Women and Foreign Policy at the Council for Foreign Relations, and the panelists of her session can come as well. Let's give them a round of applause.
Good afternoon. How is everybody? You've been sitting here, having an amazing day, and I'm really delighted because we couldn't have a really more compelling group of people with distinctly different vantage points to talk to us about the intersection of climate and health. It's really important because I think so many times in what we read and what we see on screen, people get to live in exactly one dimension. And the reality is we all inhabit the and. Women don't just live in health, they also live in climate, they also live in any number of issues that are grappling and vying for their attention. We were joking a little bit about many things, which we will not talk about today, that are rather depressing on the global health stage. But we have really 4 beacons of light to talk with us about this intersection, about what it means. And I'll just start with a little bit that we worked on this paper in 2014, which all of 2 people read at the time, which was about climate, natural disaster, state fragility, and child marriage, and how every one of these issues are tied together. You cannot talk about one without talking about the other. And while everybody likes to talk about statistics and start with the numbers, I want to also say that every statistic starts with a single life. And it really matters how we see and who we see and how we tackle what we count and who counts. So that's really what our panel is here to do today. I will really be delighted to just start and dive in because you all have your programs and we have limited time. So having 2 doctors and 2 innovators, we actually are in amazing hands, and we're going to have a great conversation that is going to be a conversation. And I'm actually going to start by starting with Alicia, since she is on the end here. So Alicia White is really an entrepreneur and an innovator. And I want to ask you a question that is about the whole idea of public health and public space. Talk to me about what you do to innovate at the intersection of both.
Of course. So public health and public space is something that's really important to our overall health. I'm from a place called New York. And in New York, we have a lot of green spaces. A lot of people don't know that in the outer boroughs. But not all of those spaces are accessible to the communities that live within them. A lot of our spaces in New York are used as dumping grounds. And a lot of our communities are just full of pollution. And so green spaces serve in many ways. The first way, having green space is a way for people to create placemaking spaces to gather, to come together, and to have community resources. And this really improves our mental health. Connection improves our mental health. We've seen this during the pandemic, especially in my work, where people in New York had nowhere to go. We were shut out, and there were no space for us to go. So with my organization, we created green spaces so people had that access for community.
And tell us all the name of your organization.
So my organization is Project Petals. So we're based in New York. And the second way is the creation of green spaces. So my organization works with climate and environmental leaders to create green spaces throughout New York. And these green spaces look like garden spaces so people can learn to grow their own food, urban farming so people have access to healthy eating. And this is done in places that are considered food deserts, where those things aren't readily accessible.
And it's amazing, right? Food deserts right in the middle of one of the most affluent and really well-resourced cities right in the world. And what kind of pushback did you get, or what kind of reception did you get when you first started?
So I started 7 years ago. When I first started, people at the government level, especially in the city, the issue was they didn't understand the connection between green space and our health. And my focus is primarily working in under-resourced communities. So the funding is already not there. And so for the past 7 years, I worked really hard on helping to bridge that connection and really get our city agencies and our government on par with understanding that these green spaces have positive health implications if we actually create them and give people the resources and tools to keep them sustainable for years to come.
Right, and I think one part of your work is also part of Debbie's work, which is that you can make sure that under-resourced communities get equal access to solutions.
Yes. It's important to have environmental and climate leaders at the table who are actually in the communities that are being impacted at a disadvantage by climate change, and having these ideas and these solutions, because these are the people who are living there, having them at the table is crucial. And it's not so much giving them the voice at this point, it's giving them the funding, the access, and at a policy level to make the changes and implement these changes so we can have positive health outcomes.
Yes, because the words are free, but the wallet is not. Right? And that is always an expression of people's values, especially when they say it isn't, right? Yes. So Dr. Birx, I'm going to go to Debbie and say, the question of, you have talked about, and I was reading this a couple times because it was really making me think about the mental health, repeated viral infections, and stress have a direct relationship with the ability of the immune system to respond. Green space, being outdoors, how do all of these pieces tie together?
Well, anything that de-stresses. And I think I'm just so impressed by the young women I've heard today, because they all started at meeting a community need. Not a perception of the community need, but the actual community need that the policymakers didn't see. And then you give voice to changing policy. It's just so impressive of it, because that's how change happens. And I'm just so impressed by everybody's work. So many of you, if you have young children, you have noticed that we have gone through a cycle of repetitive viral infections. And so if you have kids in preschool or school, you'll notice that they first had RSV, then they had flu, and then they had COVID. Well, what's happening now? Now they have strep. So what happens, and why does that happen? Repetitive viral infections and stress from those infections release what we call mediators, and some of them downregulate your immune system. But stress alone can downregulate your ability of your immune response, because what is released is all that we call these mediators. They tell your body that it's a stressful situation, so don't worry about bacteria and fungus and viruses right now. Worry about fight or flight, and you've got these high cortisol levels and things don't work. And so just like you have a knee injury and you can chronically, if you don't take care of it, it gets worse and worse with repetitive infections without rebuilding your immune system through green spaces, through being outdoors, through interacting with other people with shared empathy. You can't really rebuild. And so as you see your children going through these cycles, or your elderly going through these cycles, providing them opportunities to rebuild and have that less stress from them. I say this to people all the time. Schools in the South that were open also had severe learning loss. And we have to look underneath the fact whether people were open or closed to the anxiety that our children went through, knowing that their parents or grandparents could get seriously ill. And sometimes we discount that and think children can't have that experience. They definitely had that experience because they talk to their peers. And so we have to lift up everybody's mental health if we want ourselves to be immunologically healthy.
Right, and I think so many times, especially in this country, we think of climate change as sort of an arugula conversation in an iceberg country. You know, that it's sort of removed from our day-to-day. But what you're talking about is that all of these transitions and actually having the access to open space in the middle of stress has a direct impact on health.
Well, and let's be honest, if you're in Phoenix, Arizona in the summer, you're indoors. And so that's really increasing indoor pollution, exposure to viruses. And as we have climate change, those of you who remember, there is vector-borne illnesses like malaria, you remember Zika, dengue. Those opportunities are now moving north. And so whereas we had malaria, that's why the CDC was founded in the 1800s, we had malaria. We no longer have malaria, we could have it again. And so climate change is not without infectious disease implications.
Yeah, and I want to get to Mekala and your work at McKinsey, because you have talked about the indirect and direct effects of climate change on health and written about this topic. And one of the statistics that really stood out to me, and I think for those of you who've been in these contexts, live in these contexts, you live it, right? Which is that you said you've estimated that 700 million to 1.2 billion people could be exposed to lethal heat waves by 2050. Tell us more about that, because I promise we will not stay on gloom, but I really do want to just set the stage for what the stakes are that we're talking about.
Great, thank you. And it's great to be here. We were talking earlier about how conversations like this in communities like this help us all stay resilient and go back to this work. So it's wonderful to be here and talk with all of you. What do you all, maybe if I could just have a show of hands or maybe a shout out or two, what do you think is the single most important lesson to take away from climate change? Great. Any other? So I think that's true. If I unpeel that a little bit, why is that, right? So if I leave you with one fundamental reality about climate change, it's so profound. Every time I think about it and I unpack it, I get more and more insight. It's the idea that assumptions of a stable climate are built into every aspect of our daily lives. I'm going to say that again just because of how profound it is. Assumptions of a stable climate are built into every aspect of our daily lives. So if you think about this building that you're in, let's start with something super mundane, right? This building has been designed for a certain heat tolerance. It's been designed for a certain flood level. If you think about where we grow our food, all of our crops, they're designed for that climate, right? So we implicitly, day to day, make decisions that rely on stability, and we are fundamentally moving into a regime of instability. And that is going to have profound consequences because we're going to be in an era of change, continuous change, rising change, nonlinear change, if I start to use wonky words, non-stationarity. Yeah. It's going to affect how we eat, how we live, how we invest, where we choose to live. So there are profound implications. So once again, I say assumptions of a stable climate are built into every aspect of our daily life.
And that will create anxiety.
So that's...
and your mental health and your infectious disease health.
And it will affect, honestly, it will affect the spaces that you will have. Right,
yes.
Alicia, to consider green, right? So and everything from the materials that you're using in your clothing to what you choose to eat that day, every single bit of it.
And so when you think about human health, it relies on all of these things, right? Your mental health relies on all of these things, but also the profound ways that climate change will affect human health. It's not just one thing. So as we experience acute flooding, right? There could be risk of injuries, risk of fatalities. As we experience chronic changes in temperature, it's funny when climate change started to become talked about, we used to call it global warming. If anybody is old enough like me to remember that phrase, we stopped calling it global warming, but that doesn't change the reality, right? At its core, it is about heat. And so we're going to see more and more parts of the world exposed to heat conditions that make it hard to work outside, that expose 700 million to 1.2 billion people by 2050 to risk of lethal heat waves. This is in an extreme scenario, but that scenario that we modeled was a 2.3 degrees Celsius world, so it's not at all out of the realm of where we could be on climate change. So we're going to be exposed to acute events like flooding. We're going to be exposed to chronic conditions like heat. We're going to see expansion of vector-borne diseases. One of the estimates that we've seen suggests that the conditions where dengue can thrive, land areas that are exposed to that could expand by 30 to 50%. We're going to see increasingly healthcare supply chains affected, right? So supply chains exist in parts of the world that are vulnerable to events. So the things that we rely on to protect ourselves could be affected. And we're going to see impacts on mental health. So this is just an example of how assumptions of a stable climate are built into all of our lives, in this example with health, right? And so what does that mean in terms of how you respond? Now, you can look at these numbers and say, okay, these are big, alarmist, scary numbers, and that is causes paralysis, it causes inaction. I actually choose to look at it the other way, that this is inspiration to act, right? This is why we have to act, why we have to move, why we have to motivate ourselves. And I think about this in 2 or 3 different ways. The first is that it gives us a North Star. You said I was a doctor. I'm actually a fake doctor. I'm an engineer.
No such thing as no such do agree. Yes.
I have a PhD in mechanical engineering, but this is why I do like numbers and data and statistics, right? Because it gives you a North Star. What are you working towards? How do you best act? So this gives us that North Star. It tells us where and how to act and intervene. The second thing it says is that we do need system-wide preparedness. We need healthcare preparedness. We need companies to think about risk in their supply chains. We need governments to act and be aware of these risks. One of the things that astounded me, by the way, during COVID was I talked to someone that was a trade official in a government that I will not name. And they were astounded that they had supply chains that were concentrated in certain parts of the world for certain products. I mean, it just blew my mind. I was like, you can look at the trade statistics and know these facts. So anyway, we need system-wide preparedness. And then we need community preparedness, right? I think the fact is that what is so profound about climate change is that it's both systemic, it's going to affect each and every one of us, but it is also profoundly local. So impacts will change in different parts of the world in different ways, which means that communities need to be equipped to respond. So we know that now. So with alarmist on the one hand, but also now we know what to do.
Right, and it's almost like you're talking about sort of a re-D and we, which you can talk about sort of thinking about some of this stuff, and you're all hitting on the themes, re being the resilience piece, right? And D being the decarbonization, and we as a sense of a shared sense of destiny once more, because I do not think that that can be a casualty of the climate conversation, right? And you have to have a shared sense of fate in terms of what happens to the planet that you live in, to a community, to a health community, right? To be able to act collectively. And that brings me to your work, Leah. And when I said Leah, pronounce your name, she said it's like Star Wars. So I'll share that with you. Because we need that, we need the Force right now. And I wanted to ask you about this. You have done a huge amount of innovation around the intersection of food security, which is now quite chic to speak about. But when you began your work, I mean, very few people were talking about food security as a real tangible pursuit, right? So talk to me about the intersection of food security and public health, and why does sustainable food and sustainable health go together?
Right. So as a Jedi, what I did. No, I'm kidding. So I think, food is a way for all of us to bring all of these the very abstract concept of climate change and what we can do, like really home. So the way I approach it and the way we can all approach it is, through the second largest contributor to climate change, which is food. And food waste in itself, tackling food waste has one of the highest impacts on climate change. Second only to refrigeration, if you've all read Drawdown, which if you haven't read it, read it. It's fantastic, big book that gives you the intersectionality of all the things we can do on climate. So, we waste almost 1/3 to almost half of our food supply. And what that does is a couple of things. It's SDG 2, which is zero hunger. We have enough food to feed everyone who is hungry in the world 4 times over. It's a distribution issue. And then, because it is the second largest, thing we can do to affect climate change, all of us can do it, because half of food waste in the developed world is actually our homes, is what we cause in our homes. So that bag of salad that you bought with good intentions, or that lemon or the avocado you missed the hour where it was good to eat, it's actually what we can do concretely every single day.
Can we pause there for a second? Because so many times this is an abstract conversation. Right. You're saying, actually, the brown bag of groceries or the cloth sack of groceries really makes a difference. How do we make a difference if we say, but what do I do tonight?
What do you do when you grocery shop, again, right, is to actually be very intentional in what you buy. Don't buy the sample. How many of you bought the sample and it didn't taste as good when it got home? But yes, so be very intentional in what you buy and really consume it.
My father was born in Iraq, and he used to always say, but it's amazing they give these to you to try. And he was always the first one to buy the sample. So, but it's true. It goes to this point of take what you need in places that have that privilege.
Right. Yes.
Tell me briefly about the difference between when you began doing this work and now, in terms of people's reactions to it.
Right. Yes. So a really good way I do that is, 9 years ago when I started this, how many of you knew that we waste almost half of food supply? Maybe 3 people would raise their hands. And I think most of us are aware that that is happening. And it's happening not in a tiny way in the sense that our mothers told us to finish what's on our plate. It's extremely egregious that, 20% of all the water and land in the US, are used to grow food that we will never eat. And when we talk about
fifth,
that's 1/5 of all the land and water, and you think about California and drought, it changes the way you look at the food you get off the shelf in the supermarket.
Well, and it's interesting because to the point of the next panel, if women had equal access to agricultural inputs, they could actually make up for food that was lost to climate. Right, and so this becomes also a point of question about access. And I want to go to Alicia, and then I want to kind of ping pong a little bit before we get to our last question, which is the policy. What is the intersection between the policy level and the ground level? Because every one of us, we've had the privilege of being at the community level, and then you fly above the clouds and you see the conversation in the lounge is not the same as the conversation on the ground. Tell us about the way those intersect.
For me, policy changes need to start from the ground up. It hasn't always been that way, but when we think about our environment and we think about climate, we need to start at those communities, to me at least, that are being disproportionately impacted by climate change, because that's where we're seeing the worst of it. My organization works specifically in under-resourced communities to build these green spaces, but we've also worked on environmental policy. One has been the Environmental Bond Act of New York, which is the largest environmental bond act to be passed in New York history.
What did that do? And what does that do?
So the Environmental Bond Act pays for our need for green jobs and new infrastructure. So as we enter where we all are now in climate change, we're going to need new infrastructure. A lot of the flooding that we're seeing in New York, for example, that we have seen in past storms has been due to climate change, of course, but also, to your point, poor infrastructure. So it's really getting these communities ready for what's to come and really getting our climate resiliency up.
Yes, to the resilience piece. And at the community level, what is the reaction to the spaces now that they exist?
The community has really loved the spaces. And I think what's most important is now the city government also understands what we've been working on and the importance of it. We've seen it through the pandemic where, as I said before, people didn't have access to green spaces, but also the fact that now people have access to produce, people have now access to climate education and environmental education is really important for the community at large. So it really has been a positive response.
And Deborah, when you think about the community response, oftentimes it's really hard for people to understand what it is that healthcare officials are asking from them at the policy level because politics gets involved. Talk to us about how you find the interaction with community health leaders and what do they express to you that they need in terms of the intersection between the climate piece and the health piece?
So I think we have like 2 years right now because for the first time in my life, governors actually know that there's diseases. They know their hospitals, and they know what a PCR is. So this is our moment to link those things together and to show how changes at the community level have huge impact on their costs, which keeps people out of the hospital. Every time you keep someone out of the hospital, that's saving them Medicaid and Medicare dollars. Even with Medicaid expansion, that's a cost to the state. And so the really key of this, and this was taught to me by Vital Voices 25 years ago when it was Madeleine Albright and Secretary Clinton, you have to measure things to convince policymakers. And when you show that green spaces decrease admissions for asthma and diabetes and hypertension, now it's a whole different ballgame. And being able to collect that data and show them, sometimes you need stories, but you need stories connected to outcome and impact data, not outputs and inputs, but actually outcomes. And I think you're on the road to showing real outcomes because we can be able to see how the health of that community is changing and evolving, and even potentially increase in learning, the educational test. All of these can be linked together, and I think we have a short window. because governors will forget. And they'll forget the pandemic, and they'll forget the devastation in their hospitals. But it's our job right now to take advantage of their situational awareness and really drive a lot of these new programs and policies through.
Right, and I guess that gets to, you can't count what you don't see, and you don't invest in things that are invisible. And I think, part of your work, it has really been about making the invisible visible in terms of getting people to see the moment that we're in. And you talk about this permanent transition that we're about to enter. What do you think that can make it feel less overwhelming in terms of what can actually be done from a policy side that would make a difference?
Well, I think if I had to pick one thing, it's better data and information, right?
So you think the numbers behind the action?
For policymakers, right? Yeah. It's both. I mean, the food statistic you mentioned, if you think about how people have historically accessed the climate issue, they have treated it like it's an energy problem, right? Meaning we need to change, we need to move away from oil and gas and coal and fossil fuels, and we need to move to renewable energy. And yes, that's a part of the transformation, but it's also a food problem. It's also a health problem. And so part of this is also giving people the data and the information to know where they need to intervene, and then thinking about the solutions that work. And what I love about some of the examples that you were describing is there are solutions that can hit multiple objectives at the same time. So identifying what those solutions are that can actually do that, have multiplier effects, I think that's where the
showing return on investment.
Exactly.
Because, if you can show to that mayor, it's less landfill, it's less garbage trucks, it's less this, then they can see that there's cost savings to their community. Yeah. All I would ask is you negotiate up front that if you have this impact, this amount of that dollar saved will go back into the community. Because we don't negotiate well, and we really need to be very strong in our negotiation about if we save you money, we want that back in the community, at least a portion of it.
I like that.
That's right. What do you think? Is that
No, I 100% agree. I actually love that. So that's actually going to be a policy I'm going to put in place in my organization.
Yeah, and I guess maybe just coming back to this whole notion, and I want to do a roundabout policy because I think the ground level is very important and the high altitudes are very important if you're going to actually make change. There's a saying in Mexican Spanish, from the word to the deed, much is lost. And what we're trying to do is make sure that nothing is lost from the word to the deed. So Leah, when you talk about policy and what could make a difference, we talked about being responsible for your own refrigerator, right? And thinking about you in the basically aisle awareness for all of us. Talk about from the policy side, what do you talk to them when they come to you and say, okay, what do we need to do? What do you talk to them about?
Yeah, so in the world of food and agriculture, there's a lot of movement towards, not only sustainable agriculture. To go down to kind of more brass tacks in terms of food waste, the Food Donation Improvement Act just passed, which is, trying to keep us up in pace with where Europe is and how we treat food waste, and trying to go in the direction of, where we're trying to get plastics and other recyclables in, because we're not even there yet with recyclables, right? But so it's
stop. Tell us more about that when you say we're not there yet with recyclables.
I mean, only it's a really 1-digit percent in terms of what in the percentage of plastic and glass that we're recycling currently, and that battle has been going on for decades, right? So it's in the policy level we're going the same way, right, with food and agriculture and food waste, but we also all know that it's not going fast enough. I mean, we've seen in the IPCC report this past couple of weeks where we're going to cross the 1.5 level. So it's a lot about knowing, the panel earlier with the local government, starting from there and really putting your votes where, and being very responsible where you put your votes.
Well, and I think that's what it is that, and we're going to do one lightning round of last question. I'm going to do a Mad Lib, which you're all going to fill in, which is this whole notion of, can we create more for more, right? Can we create a situation where more people have more of a stake in creating more growth for more of us? And I think all of what you are advocating is thinking through, how do we get back to a shared sense of we're in this together, and even in permanent transition, we can create spaces that allow growth and that allow health together. And so my question for you all as we leave with this amazing group is, if you could do one thing to make an impact right at the intersection, at the cross street of climate and health, what would it be?
I would say it's important to support environmental and climate leaders and community leaders that are doing the work at the local level, because that has a big correlation with our health. So that would be my takeaway.
Don't accept no. Never accept no. No. It means no today. Just go back at that every single day. It took us 5 years to change village level child marriage. It took us 6 years to change informal fee structures in West Africa. Everybody said it couldn't be done. Women know these things can be done. Just never accept no.
So my answer.
They will call you names.
My answer is both for climate change and health, and climate change more broadly, which is the point I made earlier, right? Really, each and every one of us understanding that assumptions of a stable climate are a part of everything we do. Every financial system, every economic system, every social system relies on that. And so for each one of us, as we go back to our jobs, questioning those assumptions and challenging them and thinking about how we need to act differently if we aren't in a stable climate anymore.
Yeah, so, of course I have a hammer. I'm going to use it. So the gateway to both health and climate that we make decisions on at least 3 times a day is what we eat. And it's as plain as that.
So I will leave you with that. Local leads from Alicia. Say no to no from Debbie. And I think, Mekala, we're talking about a stable climate shapes all, right? And then I will let you say it.
We make a decision 3 times a day. We can make a decision for climate and health with what we eat.
Unless you're restricting, and then it's twice a day.
Oh, intermittent fasting. I'm kidding.
Intermittent fast, right. But I want to thank. Oh, there's a question from the audience. Yes.
I just have a quick question. Thank you so much, ladies, for what you have. It's very interesting. I just wanted to ask you really quickly on how we go beyond to engage more underserved communities. And what I mean by this is definitely having a more conscious consumption and how we consume plastic and all of this. These are big issues. But for instance, I didn't introduce myself. My name is Laura Natera. I work with the United Nations, specifically advocating for women to be more engaged in the negotiations of climate change. And one of our work is mostly with Latin America, where, for instance, there's a lot of gang violence. So in underserved communities, they have these big problems. How do I go about making them understand the importance of climate change when they say, well, how do I worry about recycling when I cannot even get the gangs out of my front door? So they seems like a luxurious problem when it's a problem for all of us. So I just wanted to get your perspectives on that.
Yeah, I think let's go to that. And I think that's actually not so different from some of the contexts we hear in the U.S., right? Which is that this is a luxury of a conversation. And I think bringing it to the ground level is exactly what we need to do.
I would say from my organization specifically, one thing that we did is we created youth programs and adult programs that were centered around climate education and environmental education to really help people understand climate education, environmental education, but how it impacts them. So maybe finding some program where you find a correlation between what's going on in their environment right now and how it's impacting them could have that connection. And we also created spaces that were considered like urban farms and garden spaces. And in the spaces that we did see, in our spaces at least, acts of violence come down in the under-resourced communities that we worked in. Because now you have a community space where people feel a responsibility to take care of it collectively. And it's not just a space for one person. So whenever you have a program that is more of a collective source, you will see more people wanting to get involved, at least from my viewpoint.
Anybody else?
No, I think that's really, you have to meet the community where they are. And if their issue is gang violence, you're going to have to show that intersection that you just described so perfectly.
And just one thought on that before we close, which is that fewer than 34% of the negotiating teams at COP27 were made up of women, even though 80% of those displaced by climate are women. So the math is up to all of us. And, the transition to clean power also requires a transition in power. And I think that's the conversation of the next panel is going to have. And with that, I just want to say thank you to all of you for an incredible conversation.